So I met Dr. Ilja some years ago, and on a professional level, and then we became friends. And then he asked me to help him to solve some complex cases. I've been a consulting member of his team. His practice has been growing a lot. The quality of this practice today is top in the world. The practice itself has grown a lot as well, and very successful. And I really enjoyed to be on this team. I don't know if you want to add something.
Yes, thank you very much, Paulo. Yes, you remember I was your student many years ago. It was now over 15 years ago. I went the first time at your lectures in Lisbon, Noble Biocare supported lectures at your big practice, at your big clinic. And when I was the first time hearing about the immediate-load concept of All-on-4, it was actually already 20 years ago when I was hearing the first time about the concept. And 15 or 16 years ago, I decided that I want to apply this concept. And of course, only with Professor Paulo Malo, who was the inventor of the concept of All-on-4 and the developer of the concept of Zygoma dental implants. Because before 15 years ago, I was everything doing in regards of dentistry and implantology and all the surgery the conventional way. It's nothing to say about the conventional way for a dentalist. Patients is as well a good approach to make a huge bone graft, to wait 6 months or 1 year and then make the dental implants and then wait again. But it's not really what the patient wants.
Yeah.
The patient wants to be treated as fast and as uncomplicated. Yes, because All-on-4 is complicated, but for the patient as fast and as uncomplicated as possible. So, and then I visited Paulo at his lectures, and it grabbed me a lot, this concept, and I started learning with him a lot, doing a lot of listening to a lot of lectures, getting in contact with Professor Malo to get his opinions, and step by step the complexity of the cases which Concept Dental is doing was growing. We had a lot of referrals, so we are not doing too much standard All-on-4 cases. Mostly we are doing very complicated All-on-4 cases, and the very, very much complicated cases, which we have quite a bit of them, Paulo is coming to us and doing the support. He's doing the supervision, he's doing the consultancy, supervision, and is helping me when I'm doing the surgery to be on the highest level in regards of Zygoma-Implantology, in regards of Quad-Zygoma-Implantology, and in regards of prosthodontics.
Yeah.
Because Paulo has a lot of experience in regards of prosthodontics. We built now our lab to the standards of his recommendations, with the best equipment which is out there on the market. And we are going together in Concept Dental. And this is, by the way, as well, Malo Dental Berlin. Yes, it's Concept Dental / Malo Dental Berlin. Paulo has a lot of Malo Dental.
Berlin-Brandenburg.
Berlin-Brandenburg. I'm very sorry. This is where we are. We are supporting all the patients, and I would say the most cases for Berlin-Brandenburg. It's like 25% of Germany we are covering in our team, and Paulo has a lot of Malo dental clinics all over the world, and we are responsible for Germany, I would say. Yes. And we are building here in our practice everything in regards of his experience, in regards of his recommendations. And this is why we can solve all the problems on the highest level with the highest quality. And we are very grateful. He's coming once a month or once every 2 months. We are doing around
Sometimes twice a month.
Yes, sometimes as well twice a month. We are doing about 6, 7, 8, 9 very, very complicated cases together, most of them or all of them under general anesthesia. And I'm very grateful because with your support, I can feel secure, and I can solve, by doing the surgery for the patient, I can solve every case. There's no case which we, until this moment, and I don't think the moment will change, that we had to say, sorry, dear patient, I can't help you. We don't have cases like this.
Yeah, this is, yeah, exactly. This is very important. This partnership between actually Paulo Malo Dental, Paulo Malo International, and Concept Dental with your team, it has been now for some years. I don't know how many years now.
7 years.
7 years now. It's amazing. The time really goes fast.
The third.
And it's really been a successful practice. There's no doubt. I mean, I can see this every year, coming year, or even every month. I see changes. Better quality, more staff, more space. So this is really to me, it's really motivating. To me, I really enjoy this. I actually feel like part of this family.
You are.
And I really feel very good here. No doubt about it. We are Paulo Malo International. We are the biggest dental company in the world in terms of geographical footprint. We are present in 22 countries. No one else has this presence. And there are, of course, countries that we are very big, like China, with more than 400 clinics and this and that. But in Europe, I would say that besides Portugal, Germany is right now probably our number one country at this moment. And this is thanks to this partnership between Paulo Malo International and Paulo Malo Dental and Concept Dental. So I really enjoy this. I really
enjoy as well. Very much. It's very good for us as professionals, for me as professional, to have somebody I can jump very quick on very high levels in regards of dental surgery. And I'm very happy, to be honest, for the patients, because they have an address where they can come and they know they will be helped. There will be, with our clinic, with our consultations, I can promise for the patient that I will have a solution for them. It doesn't matter whether it's one jaw all-on-4 and the other jaw another treatment, or both jaws all-on-4, or any treatment they need. They will get a quick treatment plan, a good solution, a good price, because we are working very, very effectively, and we are doing all the surgeries under general anesthesia. Yes, what we're doing, first of all, we are on the latest level in regards of our trainings. We are doing permanent trainings and education, post-education in regards of oral surgery, implantology, and all-on-4. Most of my education I do with Professor Paulo Malo, because he's on the highest level. But I as well go to USA. I went not long ago with studying with other very progressive teachers, which has a lot of experience. So education is number one. Education is number one. Number two is a very good team. We are training our team. Our team is specialized in very complicated cases, because not every team can do like we are doing around 10 cases a week. We need the right team for that. It starts with the reception, it goes with the lady who is writing the treatment plans, then it continues with the assistants and with the technicians and with the surgeons and with the general dentist. So everybody knows what needs to be done, and we have an education facility within our practice. We have like a big room for 30, 40, 50 people, which is connected with IT, and we are sitting together and doing together talks and having some discussions where we can get even better. And we're getting examples, of course, from your team, so we know in the end exactly what the protocols are. So we are working, this is the right word, we are working with protocols. We have for every step which we are doing protocols, which we received already 7-8 years ago from somebody who's doing it already for 30 years, and this is Paulo. And these protocols we are following, and then we are meeting frequently in our education facility with the whole team and discussing these protocols. And very important as well is the game between the surgeon, the dentists, and the technicians. These are as well certain protocols, which appointments we do when, what we do, what can we do if something needs to be changed. So we have for everything written down rules. I'm very, very conscious about customer service. We are nice to our patient. We are understanding to our patients. We understand that the patients are, we understanding that our patients are getting through a lot of stress. We are trying to minimize the stress as much as possible by making the treatment very, very effective. Starting at the reception, going to the discussions with the dental technicians, with the try-ins, and in the end, going to the surgery, which are taking place in general anesthesia, where they're receiving then fixed teeth. Most of the times, it depends on the stability of the bone, but most of the time they're receiving fixed teeth on the same day or on the next day.
And this is very important also what you mentioned is the information to the patient. The communication between the team and the patient is very important, so that the patient understands what is going for, and the patient understands everything that's about the treatment.
That's right.
So that the patient is fully conscious of what to expect. This is very, very important, because a lot of people, they start telling the patient should expect this and that, which in fact sometimes are lies. And here the team is very conscious about that. It's telling the patient exactly the truth, what to expect, how to expect, how much it costs, how long it takes, and this is very, very important as well. And one of the success reasons, the reasons of success on this team is exactly the communication with the patient, the communication between the team. We can see this team is like a family. This is very, very important. And the third reason is the protocols. We mentioned already protocols. We have these protocols that we passed on to you on the Malo protocols. And these protocols are very important because personally I've been doing this for more than 30 years. I'm the person that does most of this in the world. And not only I've done most cases in the world, but also I have the longest follow-up in the world. So we know exactly what type of problems can come after 5 years, what type of problems can come after 10 years, 15, 20, 25, 30. So we correct that. The protocol is dynamic.
Yes.
Every year we change something because something happened on a patient that we did 25 years ago. And this is our advantage because most of the other people are doing this recently, less than 10 years. So they do not have this follow-up. So they will make the mistakes that we don't make anymore. So this is a very important, this is experience on the team is very, very important for the success. And the success of this clinic is not only all this that we said, and the satisfaction of the patient, because you see the patients coming with the mother and coming with the sister and coming with the cousin. What does this mean? That they are happy.
That they are happy.
Yeah.
This practice is like an open book. Yeah, we are telling, we have to tell in social media or in other ways of communication. We have to tell patients that we are here, and the patients are talking a lot about us, about this practice, about their experience, and patients are coming back. There are some complications, of course, because if a practice is doing 10 cases a week, then of course there are some, most of the cases are running very well, very smooth, but there are some very complicated cases and as well some complications. But even in times of complications, the patient feels that we take care about the patient.
You know, the difference between an experienced group like us and a non-experienced group is that the complicated cases we can do it and the others cannot do. But also, when there is a problem, and problems are all the time, when there is a problem, the experienced group knows how to solve the problem. And the non-experienced group does not know how to solve the problem. That's why we get so many patients that come here with a lot of problems, because of course lacks experience on the patient, on the side of the doctors that treated these patients. So complications are always there, and if you have an experienced team taking care of you, those complications can be solved. This is the most important difference between an experienced team and a non-experienced team. This is the most important.
Yeah. So the most cases we are solving with a lot of success because of our experience, and cases which are very complicated, which needs more care, we can solve them as well, and the patients are leaving the practice happy.